Hi there.
Hi, how are you?
I'm Dr. Torrini. So who's this that you have here today?
My pet snake, Grogu.
Grogu.
Yes.
Okay, so you're a Star Wars fan.
Yeah, a little bit.
Okay. Now tell me a little bit about why Grogu's here today. Is he having a health issue or is he here for a normal routine wellness exam?
He's just here for a routine wellness exam.
Okay, and how is he with people?
He's pretty good. He doesn't bite, doesn't
Okay.
snap at people.
Well,
He's
let's
pretty friendly.
see if we can get him on the scale here
Alrighty.
and get a weight on him. Okay. Okay, perfect. All right. Now, how long have you had him?
About 2 months.
And where did you get him?
I got him from a pet store.
Okay. And do you know if the pet store bred him there or if he came from somewhere else?
No, they said they got him from somewhere else. They weren't sure.
And was this here in Colorado?
Yes.
Okay. And you can go ahead and pick him up unless he's comfortable there on the scale.
Yeah, he's pretty quiet.
What's his normal diet?
He usually eats like mice or quail. He's pretty good about eating both.
Okay. And when was his last meal?
About 2 weeks ago.
Okay. And normal stools and urates?
Yeah, it seems to be.
And has he shed since you've had him?
No.
He hasn't. Okay. Did they tell you when his last shed was when you got him from the pet store? Okay. Any health or behavior concerns with him?
I'm not finding anything. He seems fine. He's very active.
Okay.
Eats well.
All right. Well, let's start a physical exam. I'm going to go ahead and pick him up if you think he'll be okay with that.
He'll be fine.
And we're just going to kind of let him climb through my hands and towards you a little bit. If you want to take his front half, I'm just going to palpate him and see if I feel any abnormal bumps, lumps, or lesions on his skin. And everything feels good. And I'm also checking his body condition. And I should be able to feel his spine and ribs if I push down slightly, but I shouldn't be able to see them. But I should be able to find them. And so he's good. I'm going to put his body condition down as a 5. Okay. And I've got his weight down. And now I'm going to go ahead and see if I can, I'm going to have you hold him for a second. We're going to check his heart rate and respiration. I'm going to try to do that with the regular stethoscope. If this doesn't work, because sometimes they move around a lot and the scales interfere with the noise, I can get a portable Doppler machine and we can listen to it that way. And I'm also going to put a piece of moist gauze over this because that helps reduce some of the scale sound a little. Okay. And just let him rest there in your hands. And I have to find exactly where his heart is in his body. Usually it's in the upper third or towards the middle a little bit. He's being really good about this.
He's usually pretty calm.
I'm just going to count. Okay, great. He was really cooperative about that. We didn't even have to get the Doppler. Okay. I'm just going to take a reading of his external body temperature because we don't use a regular thermometer to get the snake's temperature. Their internal temperature is depending on the external environment. So right now, he is between 80 and about 78, and that's about right where he should be at ambient room temperature, no problem. I do want to ask you about his normal basking spots. So what's his basking spot like at home?
He has a rock that he lays on, which is under a heat lamp.
And about what's the hottest it gets there?
Usually about 80. Keep it right around 80.
Okay. I would recommend that for this particular species, this is a Super Dwarf Reticulated Python, and I would up his basking spot a little bit to maybe 85.
Okay.
Especially when he's digesting a meal. And do you know what the cool side of his enclosure is like?
It's like 62.
And that's a little bit cold.
Yeah.
So for this species, you're gonna wanna keep it down into the 70s
Okay.
for the cool side. And then the basking spot, just that area where he basks, about 85.
Okay.
And what kind of an enclosure is he in?
It's the glass enclosure that I got at the pet store.
Okay, and what are you heating it with?
I have one of those heat pads that sticks on the side.
Okay, so you're not using overhead heating or lighting,
No.
so he doesn't have any UVB or anything?
He just has that one heat lamp that.
Okay, so what I would recommend is that if there's a spot where you can put overhead lighting and heating, that you use a halogen bulb and a UVB so that he can get ultraviolet B radiation, and that's going to help him synthesize vitamin D. Even though he gets vitamin D in his whole prey, their bodies can still synthesize that from the sun. So I would recommend that you put that above his basking spot.
Okay.
And then the heat mat's okay for supplemental heat at night in case the room temperature gets a little too cold. What do you keep the room temperature at?
Room temperature is about 75.
Okay, so that's perfect. So the last thing that we want to do is just proactively swab his mouth and send off a sample for any viruses that are common for this species to carry or be infected with. And that includes serpentoviruses like nidovirus, paramyxovirus, and arenavirus.
Okay.
So what I'm going to do is and I also want to check his mucous membranes and look at his eyes. So I'm going to go ahead and take his head now. And I'm going to open his mouth and look in it, and I'm going to get a swab.
All right.
Okay. And this is usually the part they like the least. So, if you just hold him behind the head like this, I'm going to open his mouth with this. His mucous membranes and gum color look good, and I'm just getting a coanal swab and a little bit towards his esophagus there in the back of his mouth, and I'm just getting a good sample of DNA from inside his mouth here, and then we will send this off and do that lab and make sure that he's not carrying any of those serpentoviruses that I mentioned.
Okay.
And then everything looks good. His eyes look good. He's behaving really well. So do you have any questions for me?
No, I don't think so.
Okay. Well, you can go ahead and let him crawl down or put him in his carrier, and I will get all this taken care of, and then I'll get somebody in here to check you out.
Okay.
Thank you.
Thank you.